We are live now.
নমস্কার, সুনেত্র ফ্যামিলি আই কেয়ার সেন্টারের সৌজন্যে ফেসবুক লাইভ পেশেন্ট এডুকেশন সিরিজের গত দুটো এপিসোডে আমরা গ্লকোমার রিস্ক ফ্যাক্টরস এবং আর্লি ডিটেকশন নিয়ে কথা বলেছি। 7ই মার্চ থেকে 13ই মার্চ অবধি ওয়ার্ল্ড গ্লকোমা উইক অবলম্বনে আজকে আমাদের গ্লকোমা সিরিজের অন্তিম পর্যায়ের আলোচনা গ্লকোমার ট্রিটমেন্ট নিয়ে। সঙ্গে আছেন সুনেত্র ফ্যামিলি আই কেয়ার সেন্টারের গ্লকোমার প্রধান ডক্টর অমিতাভ বিশ্বাস। গুড আফটারনুন ডক্টর বিশ্বাস। তাহলে আমরা আজকের আলোচনা শুরু করে দিই।
হ্যাঁ, নিশ্চয়ই। আজকের টপিক হলো যে হোয়াট ডু ইউ ডু ফর ইয়োর গ্লকোমা। মানে আমরা এর আগে গ্লকোমা রিস্ক ফ্যাক্টরস নিয়ে কথা বলেছি, যে কাদের গ্লকোমা হওয়ার সম্ভাবনা বেশি। আর তারপরের এপিসোডে আমরা কথা বলেছিলাম যে গ্লকোমার জন্য আর্লি ডিটেকশনের জন্য আমরা কি কি করতে পারি। আর আজকে ধরো ডিটেকশন হয়ে গেছে, তাহলে এবারে আমরা ট্রিটমেন্ট বা সেই গ্লকোমা ম্যানেজমেন্টের জন্য কি করতে পারি। আমরা আগে বলেছি যে গ্লকোমা যত তাড়াতাড়ি ডিটেক্ট হবে বা যত তাড়াতাড়ি ট্রিটমেন্ট শুরু করা যাবে, তাহলে ব্লাইন্ডনেস প্রিভেন্ট করা যেতে পারে। তো আমাদের এই ট্রিটমেন্টের জন্য যা কিছু ম্যানেজমেন্টের জন্য যা কিছু ডিসকাশন করব, তার এম হলো একটাই, যে ব্লাইন্ডনেস প্রিভেন্ট করা গ্লকোমার জন্য। সেই জন্য তো এই ইন্ট্রোডাকশনে
তাহলে আমরা একটু আগের এপিসোডগুলো রিভাইজ করে নিই আগে।
হ্যাঁ, বলো।
আগের আমরা দুটো এপিসোডে একটু জাস্ট রিভাইজ করে নিই।
Yes, of course. So what is glaucoma? Glaucoma is a condition where pressure inside the eye increases, leading to slow reduction in vision.
So, how does glaucoma happen? The inside of the eye contains a fluid that is constantly flowing into and being drained out of the eye. The fluid is not the same as tears. Think of the eye with a tap that is always open. Water flows through if the drainage is working. The trouble arises when the drainage is blocked and the water begins to accumulate. Same way, when the eye's drainage gets blocked or ineffective, the fluid gets collected in the eye. As the fluid builds up, it starts to exert pressure inside the eye.
High blood pressure affects the body. Similarly, high pressure inside the eye affects the eye. However, a word of caution that blood pressure of the body and eye pressure of the eye are not directly interrelated. Here
The
is a
world
video
is full of beauty, adventure, and magic. And everyone should be able to experience this. Protect your sight and experiences. Don't let it be threatened by glaucoma. In India, glaucoma is the leading cause of irreversible blindness, with at least 12 million people affected and nearly 1.2 million people blind from the disease. People have a higher chance of suffering from glaucoma if they have high eye pressure, family history of glaucoma, suffered a prior eye injury, diabetes, migraine, high blood pressure, thick optic glasses since a long period of time. Little is known about glaucoma. However, early detection and treatment helps in managing glaucoma. Here are some helpful measures you can follow. Protect the eye from any kind of injury. Eat green, orange, and yellow foods for better eye health. Exercise to stay healthy but carefully. Make sure to use sunglasses when stepping out. Opt for regular eye checkups. Take medicines as suggested by the doctor. Take care of your sight to see this magical and beautiful world. Let's celebrate. World Glaucoma Week from 7th to 13th March with the whole world by ensuring proper eye care. As you know, the world is bright. Let's save our sight.
ওয়েল তস্মিতা এই ভিডিওটা তো মোটামুটি আমরা যা কিছু ইন্ট্রোডাকশনে বলেছি সেটা সামারাইজ করে দিল, তাই নয় কি?
ঠিক তাই। তাহলে আমরা গ্লকোমার ট্রিটমেন্ট অপশনগুলো একটা টিপিক্যাল কেসকে উদাহরণ স্বরূপ ধরে আলোচনা করি।
অ্যাবসলিউটলি, তাহলে খুব ইজি হবে আমাদের দর্শকদের বোঝার জন্য।
ঠিক তাই।
বলো,
64 বছরের ভদ্রলোক 2017 সালে আমাদের সেন্টারে এসেছিলেন। পাস্ট 6 মান্থস ধরে একটু কম দেখছেন এবং সেটা দিনকে দিন আরো কমতে শুরু করেছিল। বলে রাখি যে ওনার ডান চোখ 35 বছর আগে কোনো একটি আঘাতে ওনার ডান চোখের দৃষ্টি নষ্ট হয়ে যায়। ফ্যামিলি হিস্ট্রিতে ওনার দাদার গ্লকোমা আছে এবং ওনার নিজের কোনো শারীরিক অসুস্থতা ছিল না।
রাইট। আমরা যখন ওনার চোখের চেক আপ করলাম তখন আমরা দেখলাম যে ডান চোখে যেটা ওনার চোট লেগেছিল, obviously there was nil perception of light in that eye. However, in the left eye, his only seeing eye, the vision was not bad. It was quite good at 6/9 and 6 part. When we did a slit lamp biomicroscopy of the left eye, there was early senile cataract changes, but that was not the main issue. The intraocular pressure was recorded high at 26 millimeters of mercury. We did a gonioscopic exam for the angles of the eye and found that the left eye angles were open 360 degrees. Ophthalmoscopic examination for the retina and optic nerve showed an advanced glaucomatous optic atrophy in the left eye. So here are a few of the test findings. On the screen's left-hand side, you can see a perimetry test report. A perimetry test basically gives a measurement of the visual field of the eye, which in turn tells us about the health of the optic nerve. Here you can see that much of the visual field has become black or dark, leaving only a small part, white part, through which the patient sees clearly. We also did a pachymetry to measure the thickness of the cornea and the central part, also known as central corneal thickness, and it was found to be 478 microns, which is much below the average normal, also signifying that this particular eye is prone to glaucoma damage more than an eye which has a normal corneal thickness. So this patient was started on eye drops. Initially, we started on one single eye drop. However, at the 1-month follow-up, we found that the pressure control or the intraocular pressure control was not enough. So we changed the eye drop. Later on, we added eye drops, but still the intraocular pressure reduction with the maximum medical therapy was far from the desired target value. So what did we do in this case? And we'll come to that. We'll just tell you that there are a variety of eye drops available for the management of glaucoma. Some of them are made abroad. Many of them are made in our own country. But by and large, most of them have a significant amount of cost in comparison to other routine eye drops that are available for general use. Sometimes drops themselves are not enough to control the eye pressure, even with a combination of drops, and then we have to revert to tablets or capsules for control of pressure. And in even a smaller number of cases, we might have to revert to oral syrups like glycerol, and in extreme high eye pressures, we might have to administer a certain chemical known as mannitol as intravenous injection to reduce the pressure and thus save the eye. Apart from medications, the next step of therapy that is available for management of glaucoma are lasers. There are a variety of lasers that are used in ophthalmology, particularly in the field of glaucoma. One of them is YAG laser, peripheral iridotomy, as we call it, the procedure. particularly applicable for cases where the angles of the eye are narrower than normal, thus making the eye prone to develop narrow angle glaucoma or already developed narrow angle glaucoma per se. We can confirm the narrowness of the angles by various scan tests. This is one of them. This is an OCT test for measurement of the angles. And then the treatment by laser is to make a tiny hole in the periphery of the iris tissue, the brown color tissue of the eye, which facilitates free flow of fluid from the back part of the eye, between the back part of the eye and the front part of the eye, thus eliminating or reducing the possibility of glaucoma damage. Apart from this, we have another kind of laser application called the selective laser trabeculoplasty. On the left hand side, we see the machine for that, which Sunetra was one of the pioneers in acquiring this machine in this part of the country. And this procedure is done on a regular basis. It's basically done in the other variety of glaucoma, the open angle variety of glaucoma, wherein the drainage channels of the eye are further opened up and additional drainage is facilitated by the use of this laser. Uh, the salient points about this laser treatment is that first of all, it's an outpatient treatment. It does not require admission or a visit to the operation theater. It does not require any specialized anesthesia other than just simple eye drops. It is painless. It does not require any special preparation or any precaution after the procedure. It is completely safe. It has hardly any possibility of anything going wrong, and the effect of this laser stays about few years, and if necessary in future, one can even repeat this procedure. So this is a good procedure which is in our hands nowadays. Now, patients or eyes which are not controlled well by medications may require laser treatment, and in patients or eyes which are not controlled even with medications and or laser therapy may require surgery, as our case in question, that 64-year-old male which Toshmita was started the description of, he eventually had to undergo trabeculectomy operation here. That was the only way his intraocular pressure got controlled from that initial 26 millimeters of mercury to the levels of 14 to 15 millimeters of mercury. And until the last checkup with us recently, his eye pressures have been quite stable between 14 and 15 millimeters of mercury. This is a procedure which now, these days, is done on a micro incision basis. So the amount of incision, the amount of cut in the tissue have been minimized over the years. It is fairly safe, fairly safe. The success rate is fairly good, very high, about 90%, and and it's and it is it is cheaper than the drops in the long run. There are other kinds of surgeries available for glaucoma, such as Ahmed glaucoma valve implantation. It's a specialized kind of valve which is implanted on the outside of the eyeball with a tube of the valve jutting into the eye, as you can see in the photograph on the right hand side. And through this tube, additional fluid drainage can take place into the valve in a guarded manner, when the pressure goes up. This is a very good operation, and but the both trabeculectomy and this valve implantation, they have their individual indications. It's not one or the other. The surgeon or the ophthalmologist can decide what will be good or better for a certain patient, and whether if it is applicable at all. Having said about these existing treatments, the future looks promising with the advent of electronically guided contact lenses with gold-plated electrodes, which can deliver a minimal amount of current into the eye and take measurement of intraocular pressure at all times throughout the period of wearing the lens, and the data can be transferred onto a laptop or a PC, and we can get a continuous reading of the intraocular pressure, which is so essential in particularly in cases known as normal tension glaucoma in particular. Apart from this, these kind of contact lenses also have shown future promise in delivering electrically guided impulses or treatment to the trabecular meshwork or the outflow channels in the eye, thereby facilitating drainage and thereby finally eventually reducing the intraocular pressure to levels more efficient than either eye drops or the existing methods of treatment known. But however, both these both these applications of contact lenses are not yet commercially widely available, but hopefully they would be available sometime in the near future, and they would really revolutionize the management of glaucoma, is what I feel. Having said this about the management of glaucoma, Toshmita, I think you should revise a few reminder messages about glaucoma for our viewers.
আগেই বলি থ্যাংক ইউ ডক্টর, খুব সুন্দরভাবে সহজ করে ট্রিটমেন্ট অপশনগুলোকে বুঝিয়ে দেওয়ার জন্য দর্শকদেরকে। আমি একটু রিমাইন্ডার মেসেজ হিসেবে এগুলোকে বলে দিই। ডোন্ট লেট গ্লকোমা জিপ ইউর ভিশন, or in other words, don't let glaucoma close your vision. Also, don't let the rhythm of your life stop because of glaucoma. Most people with glaucoma who follow their treatment plan and have regular eye examinations are able to keep their vision and a healthy lifestyle. Remember, your eyes are speaking symptoms. Help them hear them clearly. Unfortunately, in glaucoma, there are no symptoms, also known as the silent thief of sight. Diagnosis of glaucoma usually requires a comprehensive eye examinations. And lastly, the world is bright, save your sight. Screen for glaucoma periodically, at least once a year, or maybe more frequently if you have one or more of the risk factors of glaucoma.
Excellent. Very well summarized, Toshmita. These are a few very important reminders. And from our experience, we know that however much we keep on harping about these things, the awareness level about glaucoma in our society, among the educated section of the society, is still pretty low, much less than desired, much less than other important diseases such as diabetes and hypertension, for example. At our center, Sunetra Family Eye Care Center, over the last 8 to 10 years, we have been doing a glaucoma awareness month throughout the month of March every year, year after year, wherein during this month, any person 40 plus age with or without any of the risk factors of glaucoma is welcome to walk in, preferably with an appointment for a measurement of the eye pressure, examination of the angles of the eye, and an examination of the optic nerve head of the eye. And in selected cases, wherever applicable or indicated, a visual field examination as well. We do this screening free of charge, excepting, of course, the visual field examination. The rest of the tests are done free of charge for anybody who walks in, any adult who walks in throughout the month of March. This is going to go on until 31st March. Please note our helpline numbers, and I request everybody who's watching this to spread the message and send more and more people for glaucoma screening and take advantage of this screening awareness month. In summary, I would like to summarize from based on what we have discussed over the last 3 episodes, including today's, that glaucoma is the second most common cause of blindness worldwide. The prevalence of glaucoma seems to be on the increase, especially in the Indian subcontinent, and that is something for us to worry about. We know that the economic burden of glaucoma is huge, not only because of the productivity hours or days lost by the patient, but also the time, resources, and effort uh, given or spent by the family members of the patient to support the glaucoma patient. We know that blindness from glaucoma can be prevented by early detection and appropriate treatment. We also know that glaucoma is symptomless disorder. It is known as a silent thief of sight, and the only way and the only method for an early detection is by way of a periodic comprehensive eye checkup. We recommend from the age 40 onwards a checkup once a year, if not more frequently, for people who may have one or more of the risk factors, depending on the features of the eye that the ophthalmologist can best decide how frequently. As soon as the glaucoma is detected, treatment should be initiated as early as possible, and it is important for the patient to understand about glaucoma and the importance of treatment, importance of regular treatment, without forgetting to apply the eye drops. For patients who may or may not remember to, who are forgetful by nature, we must take help of the other measures of glaucoma management, such as laser treatment or surgery. Laser treatment or surgery may be necessary if the medical management is not enough in a particular case. Glaucoma, we know, is an aging degenerative disorder. We know that it is associated with several other risk factors, not just risk factors of eye pressure, which is also associated with risk factors such as high powers, glasses powers of the eye. It is associated with risk factors such as systemic hypertension, migraine, diabetes mellitus, thyroid disease, and such. It is also associated with risk factors such as trauma. Even a blunt trauma to the eyeball can cause glaucoma at a later stage. Glaucoma can also be precipitated because of long-term usage of certain types of medicines, such as steroid medications, either for the eye or for systemic use. And having said so much, we cannot re-emphasize enough to say that awareness about glaucoma can help mitigate the problem and its burdens on the society, and that is why we ophthalmologists and the World Glaucoma Association takes pain, time, resources to commemorate or celebrate. I mean, it's not a happy celebration though, to celebrate a World Glaucoma Week in the second week of March every year. At our center, Sunitra Family Eye Care Center, we conduct a glaucoma awareness month throughout the month of March every year. Apart from March, the glaucoma screening will be available throughout the year. I must add that when we do a comprehensive eye examination for a patient, that is apart from screening, the glaucoma screening part is already included within that comprehensive eye examination. So any patient who's coming here for a routine checkup, every time he or she comes, every time he or she gets a screen for glaucoma. Having said so much, Toshmita, is there anything you would like to add to what we talked about?
না, দিস মাচ একটাই আমাদের এই 3টে এপিসোড করার একটাই প্রধান উদ্দেশ্য, অ্যাওয়ারনেস অ্যাবাউট গ্লকোমা। অবশ্যই যারা 40 ঊর্ধ্ব বা 40 বছর বয়স্ক এবং যাদের যা রিস্ক ফ্যাক্টরস বলা হয়েছে সেগুলো যাদের মধ্যে আছে, তারা অবশ্যই স্ক্রিনিং করান এবং নিকটবর্তী এবং পরিবারের পরিজনকে অবশ্যই স্ক্রিনিং এর জন্য অ্যাওয়্যার করুন।
Yes. Having said that, Toshmita, I think we'll close our session with a 4.5 minutes video about the life of a patient who has glaucoma. This is quite a captivating and exemplary video which our viewers will like to see, like to watch, and gain some insight into the disease. Basically, whatever we have discussed have been emphasized in this video. The video has been produced by one of the pharmaceutical companies, leading pharmaceutical companies of our country and the world as well. And we shall play the video now. And with these words, on behalf of Sunitra Family Eye Care and on behalf of Toshmita, take leave from you viewers, and please watch the video until the end. Thank you.
Thank you.
Hi, my name is Nitya, and I'm here to meet my high school teacher, Prerna ma'am, who is really a source of inspiration. So follow me as I introduce you to her and share her story with you.
Hello, Nitya. How are you?
I'm good, ma'am. It's so good to see you.
It's wonderful to see you too, Nitya. And I'm so happy that you're following your childhood dream of becoming a doctor.
It's all because of teachers like you who taught us so well.
Come, let's sit at your favorite place. Come.
Okay. So how good is your eyesight now?
Well, I can do most of my daily work.
Ma'am, when did it all begin? And what were the signs?
I remember it was around 3 years back. I was teaching in my class and I found my vision blurred at the corner of my eyes. I thought it was due to lack of sleep and tiredness. I just rubbed my eyes and I thought it would be fine. I just didn't realize that glaucoma, the silent thief of vision, was gripping me slowly.
So how did you realize that you had glaucoma?
I was driving down to school one day as usual, and I felt this intense pain in my eyes. I rubbed my eyes, but I knew something was wrong. My husband immediately took me to an ophthalmologist. The doctor did a tonometry test to check my inner eye pressure, a perimetry test to check my vision, and some other eye tests.
You have an open angle glaucoma.
Doctor, what is open angle glaucoma?
Glaucoma is a complicated disease in which fluid pressure inside eye leads to damage of the optic nerve. This leads to progressive and irreversible vision loss. In your case, Prerna, the pressure in the left eye is 32 and right eye is 44. Prerna, start your medicines immediately. Use your eye drops regularly as prescribed and visit me for the follow-ups so that I can regularly monitor your progress. Prerna, you have to take responsibility of your treatment process.
Yes, she will.
So how did it affect your life?
It was very difficult at first. I was losing my vision, and I just couldn't see. But I got a lot of support from my family and friends. The teachers and students here made me feel very comfortable. Slowly, I accepted my condition, and to control my eye pressure, I started putting eye drops as prescribed by my doctor, did my eye exercises as recommended, and most importantly, I stayed positive.
So this means that glaucoma has not reduced your spirit. Or is it?
No, not at all. I regularly visit my ophthalmologist and follow his advice and treatment. You know, Nitya, your eyes are your windows to the world. You must take good care of them. I want more and more people to realize that they can have a healthy life in spite of glaucoma. Everyone should go for a regular eye pressure checkup every year after the age of 40, whether they have a family history of glaucoma or not.
And that's why you are going on a nationwide glaucoma awareness tour, right?
Yes.
Goodbye. Have a safe trip.
God bless you, Nitya. See you soon. Take care.
You too, ma'am. Bye. Now that was the story of my teacher, Prerna ma'am, and I hope it inspires you and many more to manage glaucoma. Just follow the treatment as recommended by your doctor and visit him as advised.